Hello, 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 everyone. Good evening. Good evening. Come on in the room. Come on in the Just Gina's room on tonight. Let's see here. Let me take that off because that is what I didn't mean to put up there. Hello, hello, hello. Good evening, everyone. All right, here we go. All right, welcome to the Just Gina Skincare Health and Wellness Show. I am your host on tonight, and we're gonna dive right in. I want to welcome all first-time viewers. I want to welcome all of my supporters that come on and view the show every week with me. And I'm going to go ahead and put up my disclaimer because I want to get right into this topic here. We're going to be talking about bleeding disorder awareness. Bleeding disorder awareness. And it's something that you don't really hear too much about, but the month of March, it is bleeding disorder awareness here. So I'm just going to put my disclaimer up because I like to be covered here. And this is just to let everyone know that the views, thoughts, and opinions expressed is solely by the host, myself. Also, I always say this, please, please, please do not abruptly start or stop any medications, any therapies. Do not start anything without consulting with your PCP first, whether it's natural or not. Please, please, please use wisdom. Just because it's natural does not always mean that it's good for you, especially if you have a lot of underlying health issues or if you're on certain medications. So I say this every time I air, always consult with your healthcare provider before starting anything, any regimen, or adding to your daily regimen, okay? So for those that do not know who I am, my name is Jeanna. I am a certified health and wellness coach. I am also a nurse with a long background in the medical field, over 20 years, have been serving in various sectors of the healthcare arena. I am the founder and the owner of Just Jeanna Skincare, LLC, all natural skincare products and services. And I'm also the founder and president of Jeanna's I Feed nonprofit organization, located right in Virginia, serving the cities of Norfolk, Chesapeake, and Virginia Beach. And I do go beyond in collaborations with other nonprofits. So tonight, can everyone hear me well? Hello, hello. I see my auntie is up here from Delaware, my mom in love from the Eastern Shore, my beautiful, amazing pastor is up here, and Elder Karen Robertson, another my assistant pastor from the new city. Thank you all for tuning in. Awesome, awesome, awesome. I'm glad y'all can hear me well. So we're talking about bleeding disorder awareness. So I'm going to kind of talk about two of the well-known or the most known areas dealing with bleeding disorder, which is hemophilia, and it is the most well-known inherited bleeding disorder. Although it is relatively rare, is what they're saying, and it affects mostly males, is what studies is showing here. Many more people are affected by von Willebrand disease. The most common inherited bleeding disorder in America is caused by clotting proteins. So I'm going to cover nutrition. I'm going to cover the mental wellness aspect. I'm going to talk a little bit about exercise, what is safe to do when you have this type of health condition here. Hello, my mentor, Dr. D. Thank you for tuning in, Dr. Dion. So I'm going to go on and read and proceed. And for those that are watching for the first time, this is not your typical health and wellness show. I just want to make that disclaimer there. I do talk about things that are not really talked about on a regular basis. And I do like to cover the more educational part of it. I do like to dig a little deeper. I like to break this stuff down. I like to go off of sound information. And this information that I do provide to the audience and the community is based off of research studies, and the studying that I do, the reading up and following up on the latest. And some of this is based off of studies from 2020 and 2021. Okay. So bleeding diastasis, it means a tendency to bleed or bruise easily. And this word comes from the ancient Greek word for state or condition. And it says most bleeding disorders occur when blood does not clot properly. Symptoms of bleeding diastasis can range from mild to severe. So some of the cause of bleeding and bruising can very widely include a normal response to injury, an inherited disorder, a response to some drugs or herbal preparations. So that's why I say we got to be careful, because I know a lot of people are going into the health and wellness arena, and I am also one of those individuals. I have shifted more to natural alternatives. However, we just got to be careful in what we ingest and what we take and put on our bodies, even if it's natural. Also, another cause of bleeding and bruising could be abnormalities in blood vessels or connective tissues. An acute disease such as leukemia can cause bleeding. That's an example. And then the symptoms are you will bruise very easily. And for those that are coming on, we're talking about bleeding disorder awareness. Those are one of the recognized awareness for the month of March. So bleeding gums, symptoms, bleeding, bruising easily, bleeding gums, unexplained nosebleeds, heavy and prolonged menstrual bleeding, heavy bleeding after surgery. And those are some examples. One of the things that we would get a high alert on when I was working in the nursing rehab center is when we would find one of our patients or residents with blood in their stool, that would indicate to us that there's some type of internal bleeding going on, and it had to be addressed right away. Blood in your urine, blood in your vomit, heavy bleeding after small cuts, such as in blood draws or vaccinations, excessive bleeding after dental work. So these are some symptoms of bleeding disorders. So the symptoms, now I'm going to talk about some of the cause of it. Low platelet count, liver disease, kidney failure, thyroid disease, Cushing's syndrome, vitamin K deficiency. So vitamin K is essential for blood clot, and that is used a lot to help aid on with people that have an issue with blood clotting. Also, anticoagulant therapy, including heparin, warfarin, Paradoxa. Those are some examples of blood thinners. And here it also has, for some of the causes, poisoning by anticoagulant, such as rat poison or substance contaminated with rat poisoning. That can also enhance bleeding disorders. It causes bleeding disorders. So now I'm going to go over here and I want to talk a little bit about supplements. It's a very long list of supplements that put you at a high risk of bleeding. I got over 20 supplements that put you at a high risk of bleeding. So, and some that people don't really hear about: anti-seed, butcher broom root, cat's claw, chamomile, fenugreek, turmeric does thin the blood. Is known as a natural blood thinner. Turmeric is. Studies show that turmeric is. And then we have feverfew. I really want to name all of these supplements here because I know some of us are really headstrong on the supplements and the vitamins and all of that. But this is something, if you're one that's subject to getting a bleeding disorder, or you're subject to bleed easily, this is something you want to be aware of. Some of these supplements are natural alternatives in herbs that put you at a higher risk of bleeding, are known as natural blood thinners. We have fish oil, we have garlic, we have ginger, we have horse chestnut, we have licorice. And I'm going to tell you something. I love licorice. I'm the weird one that likes the black licorice. Yeah, that's me. The black jelly beans. Yeah, that stuff to me. I have an acquired taste, as my friends would always tell me. I'm the one that likes the weird stuff. Also, omega-3. We have red clover, St. John's wort, vitamin E, willow, wintergreen, and then also zinc. It is very important to consult with your provider. And even the other day, I believe my assistant pastor at our church did a live about, she was came into awareness of some of the stuff she was taking on her page, that even though it was natural, it was not, it was more hindrance than help. So here also, I looked up and I did some research on essential oils. Essential oils that are taken by mouth, inhaled, or put on skin are dietary supplements. So that can be that can be considered a dietary supplement. And first of all, I don't recommend that any raw or real 100% essential oil. I personally don't recommend you put that directly on your skin anyway. It really should be diluted with a carrier oil. But I know some people have done that. But I don't recommend that I don't suggest that you do that. I think all real, authentic, 100 proof essential oil should be diluted with a carrier oil, and make sure it's a carrier oil that goes well with that particular essential oil. So some essential oils here are usually help with aromatherapy, help cope with pain and anxiety. But essential oils that are taken by mouth: wintergreen, menthol, which affects vitamin K and bleeding. So these particular essential oils have, it causes thinning of the blood. I love wintergreen. I really do. If I could put wintergreen in everything, I love minty stuff. But if you have issues that could enhance the risk of a bleeding disorder, you want to be careful with those particular oils. So now here we want to get to dietary supplements. And it says here, dietary supplements, herbal medicines, and natural products are meant to add to your diet and are sometimes called dietary supplements. So we want to make sure we understand all of the dietary supplements and make sure that we talk again, we consult with our provider, we consult with our therapist. Even with people that are receiving therapy and certain exercises, you want to be careful, and you want to talk to your therapist also about what you're taking, because it could affect the dynamics of your therapy sessions. It could affect the dynamics of how you exercise or what type of exercises you're doing. So some dietary supplements, what are recognized as dietary supplements, are vitamins, minerals, herbs, botanicals, amino acids, enzymes, organ tissues, other animal products. These are considered dietary supplements. These are things that you need to also list when you are giving someone your medication list, not just prescribed stuff from your doctor, but anything that you're taking over the counter. This list here is considered dietary supplements. And you know, I always love talking about the food part, the nutrition part of any topic that I'm discussing. So what foods help stop bleeding here? And it says to eat vitamin C rich foods, red and green peppers, kiwi. I can't have kiwi because I'm allergic to it. I got allergic to it when I became an adult, which is just crazy. But kiwi is one of the ones listed. Strawberries, Brussels sprouts, broccoli, tomato juice, green leafy vegetables, spinach, greens. And when I say greens, we want to have it where we're not cooking all of the natural nutrients out of it. I know a lot of us want to cook us, and even myself, I'm part of this saying that we want to cook our greens with all of the ham hocks and all of the good old salty stuff, but we just gotta be careful and mindful. And when we cook broccoli and stuff like that, we don't want to cook all of the nutrients out of it. We really should just steam it enough and then eat it like that to really get the full nutrients out of it. They're saying foods and supplements to avoid: large glasses of juice. So you can't go getting those 7-Eleven big cups and bringing them home and washing them out and using them to drink juice out of big cups of juice. I'm talking about you can't have big cups of juice when you have a bleeding disorder. Soft drinks, energy drinks, and sweetened tea. This is stuff you want to try to avoid. Also, heavy gravies and sauces. Now, I am doing better with the gravies, even though my baby girl, loves gravy and rice. I don't eat gravy as much as I used to, but I love making a sauce. I will just make a sauce. It'll come out of nowhere. I'll just make up a sauce. So gravy, heavy gravies and sauce, butter, shortening, or lard are foods you want to avoid. Full fat dairy products, candy. I know it sounds like everything that actually tastes pretty good, but when you have these types of health conditions, you just want to be careful of your diet. We really don't take in consideration the importance of what we ingest in our body and what we put on our body that can really affect us in several ways when we have these health conditions or these underlying issues here. So now getting into talking about the exercises here. They suggest aerobic exercise. And again, you want to talk with your healthcare provider. You want to talk with your therapist. Also, some of us, when we have these health conditions and we have all of these issues, it's really good to have an actual dietitian on board to talk to as well, along with your provider, and talk with your provider about having a dietitian that you can consult with, to help you maintain the best possible diet concerning your health condition. And I mentioned for exercise, aerobic exercises, reducing the load on weight bearing joints. Strength training includes increase the muscle and strengthen the tendons that support your joints. Balance and flexibility improves your posture and ability to move. And one of the things that what I am finding out and what I am seeing in a lot of studies is that in anyone that has ended up or caught the COVID-19 virus, we want to be careful because you become risk for blood clots. And if you already had an underlying issue before getting that, you just want to be careful and mindful and really watch what you eat. After, thank God, you make it through and everything, but you want to watch what you eat and you just want to pay close attention to your body here. And I'm trying to make sure I keep my time here. I'm doing very good here. And I covered 2 of the 4 that I like to cover, which, if you're coming on for the first time, welcome to the show. Is Just Jeanna Skincare, Health and Wellness Tips and Talk Show. I am your host, Jeanna, and I do like to cover 4 key points. That is health and wellness, nutrition, spiritual, and mental. One of the things that research studies show that this particular disease and any chronic disease, the number one thing that it does enhance in an individual is depression. And I'm finding a lot of research studies that are showing that depression is really being found mainly a lot in men, because with health conditions, chronic health conditions. And I believe that's because a lot of them men do not express themselves as well as women all the time. But it's showing that it is increased depression in men versus the women. But one of the mental illness issues are chemical imbalances that may be enhanced when you have a chronic disease or a chronic health condition. Depression does set in. So we want to make sure we have a good support group. We want to make sure, I always say this, find someone that you can trust that can learn your triggers and see when you're spiraling. I have a wonderful lady in the nonprofit community that I work and collab with all the time. And she's the founder of Your Wellness Inc. Her name is Mrs. Deborah Harris, and she is a mental health advocate. Also, one of our church members, Tasha Sauls, is a mental health counselor. So it's people in the community that can help you. And I listened personally to Miss Deborah Harris' story. She's not only a person that is an advocate, she went through it and she recovered, and she now is a voice in the community. So we have support groups. We have people that you can talk to when you have stuff going on, trustworthy people that you can reach out to in the community, that when you're suffering with these health conditions and things that it seems overwhelming, you can reach out to someone, because depression is very easy to set in when you just keep thinking about things and you just keep having these battles with your body. I don't have the issue of bleeding disorder, but I know all too well about having issues with your body and health conditions that you just don't know, you just over it and you just want it to be over. You just tired of feeling like you're feeling. But it's people out here that you can connect with. So always have someone that you can express, look, these are my triggers. If you see this, they'll know what to look for, to know the healthy you versus the spiraling you. And I don't care how strong you think you are and how well-minded you think you are, depression can come upon anybody. So we just got to be careful, and we got to take care of our body. We got to use wisdom. We got to really take in and be careful about what we eat. We got to monitor these supplements and make sure we go and do the research studies. And I'm noticing now a lot of the supplements, it does state on a lot of these bottles that you need to consult your healthcare provider before consuming the supplement. It does have it up there. It's up to us to make sure we make the initiative to do what's best for our bodies. Health and wellness, natural alternatives. We just got to be careful. We got to make sure that it's the right fit for our body. Everyone's body react to things differently. So we got to be careful. And my platforms and my businesses, they're faith-based business. I stand on the principles and the leading and the direction of God for everything that I do. I talk about God because that's who drives me to do what I do in business and in everything that I do. So for the spiritual aspect, I say make sure that you, have the support of your church. Make sure that you have to find out the different groups, the different things that your church offer. The different community organizations that are in ministry that offer things like prayer groups, prayer lines, things like that. If you're not a believer, I pray you get one. I pray that you learn about God and learn that He is the only one that can keep you. But I know that having a support group in every aspect of your life is very important. So I just want to make sure here I'm doing pretty good here on my time. So I'm trying to get back in the flow of staying within my 30 minutes. Why, you ask? Because this is my last month being on Facebook Live before I transition to Roku TV and Amazon TV. This is my last month, so I will be doing a show every Monday for the remainder month of March. Then starting April, you will be able to view my shows on Big Mind Entertainment channel on Roku and Amazon TV. Okay, so I'm just trying to get back in the swing of things. Again, thank you for tuning in. And also go and download Big Mind Entertainment on your Roku and Amazon. If you don't have a Fire Stick, go get one. Give up 2 of those crab balls and go get your Roku or Amazon Fire Stick. If you don't have it already in your smart TV, make sure you download Big Mind Entertainment. It's several shows that's gonna be airing on that particular channel. Dynamic shows that's gonna be airing, not just me, but it's gonna be several shows kicking off on that channel in April. So you want to make sure that you have that channel on your Roku and your Amazon. And I want to already thank one of my sponsors, one of the sponsors that is sponsoring what I'm doing. And I'm going to have to always shout them out. And that is none other than Cornerstone City of Refuge Ministries International, the New City Church VA, where Apostle Danny R. Ducksworth and Elder Rebecca G. Ducksworth are the pastors, and they are the first sponsors for what I'm doing, and I'm excited. I love my church, so I'm going to talk about my church. Yes. So they are very supportive, and they are supporting and being sponsors of this. So I am excited. So please make sure that you tune in. You'll just be able to go up there and watch it, just how you binge watch Netflix shows. Once the shows are up there, you'll be able to watch over and over again. If you don't get something the first time, you can go back and watch those segments. And that's for everybody, shows that are airing on that channel. So I thank you for tuning in on tonight. And also check out my website, justjeannas.com, and also my nonprofit organization. If you would like to become a sponsor of that, please check out my both of my websites. You can go and catch me on all social media platforms except for Twitter. You can go to Instagram and Facebook, and you will find Just Jeanna Skincare. You will find Jeanna's Eye Feed. I am up there. I'm in the community on a weekly basis. As a matter of fact, before this show, I was out delivering meals before I got ready for this show. So I am out there doing what I got to do to address the purpose of why I started my nonprofit. And that's because of the hunger deserts and the people that just are having issues keeping food on the table and are keeping meals prepared. Some people just are not able to prepare those meals. You know, you can give them the food, but if you got health conditions, if you're recovering from surgery, if you know, you just don't have the strength, if you're out of work, it's different dynamics. You know, so that is where I come in. That's where my nonprofit. I can't wait to introduce my team, my board members to y'all. I got a great team now, and we're going to really be rolling out some stuff in the community, health and wellness programs. I have a program director. She's amazing. And I'm excited to announce her. I'm not going to say nothing because they want to wait and have all their little stuff, you know, rolled out. So, but I thank y'all for tuning in. Make sure you tune in next Monday at 9 p.m. Go and look on my lineup. I got every topic I'm going to be talking about for the remainder month of March. Okay. And I thank you again. I appreciate you. If you would like to be on the show once it gets to Roku and Amazon, please email me at justjeannaskincare@gmail.com. And we can discuss packaging for being on the show. If it's a certain topic, we can discuss you coming on the show. Again, thank you all. I love you all. And a word of encouragement, you can do anything you put your mind to. Remove self and fear out the way and soar in purpose. Y'all have a great night. Thank you for tuning in.